Hi, my name is Louisa, and I'm a health educator at MaineGeneral, specializing in harm reduction. This series of presentations will cover specific injection-related injuries, and today I'll be talking about track marks and bruising. Track marks are the scars that you can get on your skin after you inject. When needles hit the same area of veins and skin over and over, you get scabs and scar tissue, which are the root cause of those visible track marks. Dull needles, which fail to break through the skin cleanly, can also lead to track marks. Additionally, skin that has not been properly cleaned before injection can allow all sorts of germs to be introduced into veins, skin, and tissue, which can also cause inflamed track marks. And if scars aren't kept clean after they appear on skin, they can get infected, which might lead to bigger health problems such as abscesses and blood poisoning. Infected track marks are also more visible to the naked eye than uninfected track marks. Bruises are another visible injection-related injury. When you stick a needle into your body, it first goes through a layer of skin and fat before it actually reaches your vein. Sometimes blood leaks out of the vein and pools under your skin, causing what we see now as a bruise. This can happen if a tourniquet is not untied before you push the syringe plunger down and inject. Fortunately, there are a few steps you can take to reduce your risk of bruising and scarring. They include rotating your injection sites, untying your tourniquet before you inject, using high-gauge fresh needles every time you use, cleaning your skin before and after injection, and applying the appropriate ointments to your track marks. Since scarring happens when the same site is used repeatedly, try to rotate injection sites and avoid always using the same location. And try to always use a fresh needle for each injection. If you're having trouble finding a vein at a new injection site, tourniquets can increase your vein size and make them a lot more visible. Be sure to remove the tourniquet before you push down the syringe plunger and inject, but after you have pulled up the syringe plunger to register. Failure to do this could lead to bruising, unfortunately. Needle type and care can also impact the appearance of track marks and bruises. If you can, you should use a sharp, sterile needle for every injection. You should also try to use needles with a high gauge, since they'll cause the smallest puncture wound. At Next Step Needle Exchange in Waterville and Augusta, you can dispose of used needles and receive a fresh supply. We offer 4 different gauge sizes: 28, 29, 30, and 31. If you want to learn more about needle gauge, check out our video on gauge size, located in the Harm Reduction YouTube playlist. Before and aftercare, our injection site can also reduce the appearance of track marks. At Next Step Needle Exchange, we offer alcohol-based prep pads to clean the area before you inject, and BZK pads to wipe the area clean after you inject. Avoid blowing on the injection site or touching the tip of the needle, since this can reintroduce germs to the injection area. We also offer triple antibiotic ointment for you to put on your track marks once the injection sites have closed up. You can also use aloe vera gel or vitamin E oil to care for your closed track marks. These are usually available at most pharmacies. At Next Step Needle Exchange, we offer a variety of supplies like cottons, needles, sterile waters, tourniquets, alcohol prep pads, BZK pads, and triple antibiotic ointment. These materials help create a safer, cleaner environment for drug use, reducing the risk of infection and other complications. Thanks for joining me today, and I invite you to check out more of our content on MaineGeneral's Harm Reduction YouTube playlist.